in August 2022, Malaria Consortium partnered with Uganda's Ministry of Health, Buikwe District Local Government, to deploy the Community Health Information System, which we also call the ECHIS, and is powered by the Community Health Tool. The goal of this project is to improve ICCM data use, reporting, supervision, and the management of the ICCM program, where ICCM is integrated community case management. The app has been deployed to 375 VHTs in 7 sub-counties, and they report through 20 health facilities. Now, the use cases are ICCM and stock monitoring, which is the main feature for today. To date, the app aligns with the newly updated 2021 ICCM guidelines for the Ministry of Health, Uganda. And with the app, the supervisors are able to provide targeted supervision and mentorship to the cadres below them. What has been developed are the performance and supervisor dashboards. And we are working closely with Walimu. This is still work in progress, where we are integrating the smart health discharge. This is whereby children who have been discharged from the hospitals, who have been critically sick and have been discharged by the hospitals, are now referred back to the community, and they are followed up by the VHTs. This too is going to be on a digital setting.
We have the stock monitoring workflow module implemented in the CHIs in Uganda, and it is basically currently capturing, it has about 4 features, key features, and the first one deals with tracking of stock received from health facilities and also stock returned to health facilities. This is done via an action form called a VHT consumption log. Then there is another feature that helps us track the stock dispensed. This is where, of course, quantities that are dispensed, let's say given to patients, are calculated in workflows like an assessment, if someone, let's say, has diarrhea and the community health worker indicates that they've actually treated for diarrhea, then we would expect that a zinc pack would be dispensed. So that quantity dispensed is tracked, and then it's calculated. It's part of the calculations in the balance on hand, as we shall see later in the stock status. Yeah, so the next feature is the stock status. So we keep track of stock status for each item that is used by a community health worker. This is tracked in the profile of the community health worker. So there is, of course, a balance on hand for each item, and there is some color coding that is used, which is, of course, like traffic lights. If it's red, then it means it's below the minimal level. Then if it's orange, it's not optimal. And then if it's green, then it's really optimal. And then the other feature is stock alert sent to supervisors via tasks if there is any item that a CHW has that is below the threshold has been defined. So for us to be able to get a clearer picture, I am going to do a simple demo in about, I think, 2 minutes, just to demonstrate some of these features. So the slides are going to go for a minute. Okay, all right. So when CHW logs in, this is the first page that they get. But what I'll do is go to that feature where I said we track stock received from a health facility. So I would come here, go to VHT log, consumption log. When you go here, you're able to, of course, just track the date. You get options of quantity received and quantity returned to health facility. Today I'll just concentrate on quantity received. There are sometimes, of course, when there are, for example, expiries or damages and VHTs need to return stock to health facilities. I think that's really rare. So I'll just indicate that I've received, let's say, 5 copacks. So you select an item and then you indicate the quantity received. And then if you have another one, you can of course select and then you indicate, let's say I've got a city item, about maybe 10 of them. And I'll click next. So you get a summary of the items that you've selected with the quantities that you've input. Yeah, so when you submit, you realize that the stock levels here and the stock status change based on that. Of course, that was a receipt, so we would expect an increment. I had, I think, 9 zinc copacks and right now there are 14. Then let me do a simple assessment where I would expect a zinc copac to be given out to a patient. So I'll go to Gerard household. I'll get a child that is 3 years old. And I'll do an assessment. Say it's today. Yeah, these are danger signs, but for now, I'll just select that there is no danger sign for this child. I'll say there's no cough. Since I want to give out a zinc copac, I'll say that this child has malaria, maybe for diarrhea for 1 day. Is there blood in stool? I would say no here. Go next. This child has no fever. Let's say next. There's no exposure to HIV or TB. And then there's no malnutrition, it's green, and then also no edema. I'll say he was dewormed and also received vitamin A. Yeah, so when you go to the summary, client summary here, there is diagnosis and treatment, and the saying give ORS, copac. I think the specific instruction is here. Give caregiver an ORS, zinc copac, take home, plus the dosage here. So one thing to note is that we, for example, in this workflow, we are using copac as the units for dispensing, not, let's say, not tablets or any other thing. So we'd expect a reduction of 1 since only 1 copac would be given in this case. Yeah, so when the CHW indicates that I've given this treatment, so once we submit, we would expect a reduction in stock on the stock status. Yeah, so let me submit. Yeah, so when I go back to my profile as a CHW, I would expect now to be 13 from 14 as it was previously. Yeah, and the same thing would happen for all these other items. I think that's it.
The challenges that we received were technical, especially for the VHTs who are using smartphones for the first time. Most of our VHTs are most of them are seeing smartphones for the first time. And then as Paul showed, we were having challenges when they were adding stock, the one they've gotten from the health facilities. They were pressing the plus sign. They were pressing plus instead of button when they wanted to add stock on the consumption log. Yeah. We also learned something. Like we know that our drugs in the Ministry of Health come in different, sometimes their colors change and the copacs and all those things change. So the Ministry of Health provides, when we work closely with it, the Ministry of Health provides guidance on adherence to current treatment guidelines. Then we've also learned that stock monitoring workflow has enabled supervisors to view the stockouts and redistribute the stocks without them even having to go deep into the villages to get these numbers. And yes, the most liked part of the app is the VHT consumption log. It helps all the users to update stock of medicines received and used. Thank you very much.